There are now mandatory gunshot reporting guidelines that all hospitals in the state of Alabama have to follow.
Our Cherish Lombard talked with the Chief Trauma Director at University Hospital, who tells us, Cherish, how bad the gun violence really is and how glad they are now that they have to report this. A lot of people probably thought, well, that's always been the case.
Right, kind of wild that it wasn't being reported until now. But yeah, this law just went into effect at the beginning of the month. Before then, Alabama was one of only 3 U.S. states where hospitals were not required to report non-accidental gunshot wounds. This means someone can be involved in a shooting and taken to an area hospital by private vehicle, and the police department would never be notified because of HIPAA. This law changes that. Until now, no one could accurately compare the number of gunshot wounds being treated at local hospitals to the numbers law enforcement officials were getting. Some gunshot injury patients were being treated and released, unbeknown to police.
We identified that we felt like we were seeing more gunshot wound victims than the police knew about. De-identifying and sharing some of our data, we were able to determine that we did see approximately 30% patients that they didn't know about.
According to John Simmons, Chief Trauma Medical Director at University Hospital, approximately 300 gunshot victims are being treated at that hospital alone each year, and more than half of those shootings happen within city limits.
Pretty profound when you think about it. About 200 of those come from Mobile City itself, and we see about the same number of knife stab wounds. On average, we're on route to have 2,500 trauma admissions this year, and about 20% of those are penetrating injuries.
Like most of us, local surgeons and police want the violence to stop.
We need to reduce gun violence. How do we reduce gun violence? By trying to understand why it occurs and what can we do to address those questions and those answers that we come up with.
Mobile Police Commander Curtis Graves believes mandatory reporting is a step in the right direction, and he and Project Thrive, a part of the Mobile Police Department dedicated to helping victims of violent crime, played a large role in putting this into motion.
And I was fortunate to have a conversation with State Representative Adeline Clark, who embraced our concern.
Dr. Simmons believes mandatory reporting will reduce gun violence in Mobile because police now have knowledge of where crime is occurring and how often it's happening there.
I think gun violence in general has been polarized politically, and I think if we approach it like any other public health crisis, just like car crashes have done in the past, and investigate it like a public health crisis, that we'll be able to reduce the amount of people being affected by gunshot wounds.
I asked Commander Graves why it took so long for Alabama to jump on board with mandatory reporting. He says he doesn't think the majority of legislators were even aware that we didn't have a law in place. Good news is we do have one moving forward. Now, the only states now without mandatory reporting laws are New Mexico and Wyoming. Cherish Lombard, News 5.